When it comes to cancer, significant progress has been made in treatment, particularly in the area of minimally invasive surgeries. Colorectal cancer treatments always involve surgery, but one device is making it much easier for patients and doctors. Here's KCTV5's Amy Anderson.
Angela McCarthy hadn't been feeling quite right, and while she initially blamed some bowel habit changes on the fact that it was the holidays, once she got back to eating her regular healthy diet and it didn't go away, she didn't waste any time.
I am a healthcare professional as well, so I knew probably just enough to make myself go in, you know.
McCarthy had a colonoscopy and learned she had rectal cancer. 2 weeks later, Dr. Mizrahi with Menorah Medical Center performed her surgery. It wasn't the hours upon hours surgery with the massive scar left behind kind of surgery. It was a 2-hour surgery that required just a couple of inch-long incisions.
It went really well. I mean, you know, I've had cesarean sections, and I know what that feels like. This was wonderful, actually.
Dr. Mizrahi used Da Vinci, a robotic surgical system he knows very well.
In terms of minimally invasive, it's the highest in terms of technology. So it allows me to do big surgery, small incisions. And I was one of the first in the area to use it, and I was very fortunate to be an early adopter, and now that's pretty much how I do my surgeries.
Dr. Mizrahi says the Da Vinci is not only better for the patient, resulting in a faster recovery, but it's better for the treatment of the cancer as well.
In terms of the cancer, I was able to see the anatomy, the tissue, to get to where I needed to do it less traumatic due to the technology or advancements of the robot, and able to reconnect her and do a more or a better cancer operation.
The Da Vinci offers surgeons magnification of up to 10 times in 3D high def.
So the pendulum has swung. It used to be when you do surgery, you're right at the patient bedside. Now I'm actually not at the patient bedside. I'm just a little bit away in a console controlling the robotic arms.
Robotic arms and a good surgeon left McCarthy feeling great and with a very positive outlook. She says she couldn't be happier with how her surgery went.
No big open scars to deal with, just a few little small ones. I felt like maybe I was better protected from infection and everything else because the scars are so small.
Now she says she's just ready to get on with life. Amy Anderson, KCTV5 News.
For more from HCA Midwest Health, you can visit kctv5.com and click on the Health tab.